All right, number 5, you have to learn the colors of your indicators. Even if it's your preceptor or circulator opening it up for you, you still have to know that that tray is sterile. There is no way around it. Even if you don't see it, just make sure you check, okay? Just make sure you check. It's better, it's safer, even though you trust them and they trust you, just make sure. Patient safety, number one thing. Alrighty. Number 6. Work on your upper body strength. I did. I did not know this. And I ended up holding a Brooke Walter with all-in-one tray for about 5 minutes. I don't even remember what it was about, but that was the longest 5 minutes of my life, and I was sweating like a piggy never could, because that thing was heavy, and I was just there for about 5 minutes. It was the worst 5 minutes of my life. I'm sure it was shorter than that, but it felt like I was gonna die. Alrighty, so number 7. If you haven't seen my most embarrassing thing that I haven't done, go ahead and take a look at it, but always double glove. Alrighty, usually you have your regular on top, which is the smaller one, and your indicators, which is the bigger one. On another note, in regards to that one, always have multiple gloves on you on the field. Always have multiple gloves with you in the field. Normally, I would have 3 that are over gloves and then 2 that were under, in addition to the ones I scrubbed. I was terrible with gloves, and my hands, I couldn't find the right gloves for me. So I was always trying different gloves because my hands went numb when I just had the wrong size. But, hopefully you'll be able to find gloves a lot easier than I did. Alrighty. In regards to, don't talk about your patients outside the OR. Just don't. It's very disrespectful. You don't know if there's a family member around there. I know you're excited when you're talking about cases that you've completed, that you've done. However, if you must discuss them, do so in a setting where it's for educational purpose. Like when you're talking with your classmates about cases that you've done, don't just respect the patients. Respect the patients and their families. This is a major life event for them. It's not something that you can just, gonna one day to the next, you say, I'm gonna go to surgery, and that's it. Usually, when it comes to surgery, this might be the last resort that they have available to them. More than half, actually, like about 95% of all the surgeries that I had were because of cancer. So this for patients is a life-changing event. And if we go and talk about how cool the surgical procedure is, because we as techs, I think it is the coolest thing to see into somebody else and look at their beautiful liver and see what cancer looks like from the inside, and there's a sense of satisfaction to helping people. But just don't talk about it outside the OR. It is very disrespectful. If you have to talk about it, if you have to write it down, you have to write stuff down because of your clinicals, but just do it in a way that's respectful for the patients. The patients are not just their body parts that we're cutting off. Just be respectful. Also, don't be afraid to ask questions. I started with numbers on this, but I totally went off the rail. Don't be afraid to ask questions for your preceptors. No, the only stupid question is no questions. You don't want to feel like you're stupid. You don't want to feel like you don't know anything. But then again, you are a student. You're there to learn. You're in your clinicals. It's better to ask now when you have a preceptor and somebody to help you guide through some issues than to be there after your clinicals once you have a job and not know what to do. Granted, the OR is a very, very, I don't know what the word is. Mobile? Shape-shifting? It changes from 1 second to the next. So don't be afraid to ask questions. And when it comes back to the very first thing, listen to your preceptor. If something does happen in the OR and they tell you to move, you move. Even if you know you're capable of handling a sudden hemorrhage in the brain, well, if your preceptor tells you to move, you move. Because all of a sudden, this is their patient. And you, as a student, you may compromise. So even if you feel offended, don't feel offended. You know, their number one priority is the patient. Whether they're teaching you or not, if it comes to a life and death situation for the patient, they will take over. You will be there to assist them, if possible. If they trust you enough, then it is what it is. Alrighty. Last that I have on top of my head right now is if you contaminate, be humble. Don't try to hide it. It wasn't someone from my school, but another school's who tried to hide that they contaminated a whole entire room. And if you contaminate, be humble about it. Tell them. The biggest mistake I ever made, as you can go back to my other video, was contaminating. I could have just said, you know what, I'm just gonna do whatever it is, because I had contaminated everything. So I looked like a fool, but I'd rather look like a fool than compromise patient safety. And those are the things that I can come up with at the top of my head right now that you might need for clinicals. I may make another video. I may edit this one a little bit more because maybe it doesn't make sense, maybe it doesn't, but I just wanted to share that with you guys.